Hi, my name is Mark Jacobson. I'm a board-certified diagnostic and interventional radiologist with 32 years of interventional radiology experience. I function both as a diagnostic and interventional radiologist. Having become pretty good at doing conventional injections into joints and tendons and ligaments in different parts of the body, I realized that some of the substances that we were injecting into patients, namely anesthetics and corticosteroids, actually had a harmful side to them. When I found out more about regenerative medicine and its healing benefits without all of these deleterious side effects, it kind of became a natural curiosity to want to move in that direction rather than continuing to administer harmful substances to my patients. I think my first patient is a local urologist who wanted to know if I could inject his ankle because he had been a distance runner in the past, and he said, "Look, I understand my running days are over, but I'm to the point now where I can barely stand long enough to do my surgeries, and I really need some relief, and I've tried all of this conventional stuff, and I'm tired of the corticosteroid injections, and nothing is helping, and I'm not healing, and I'm not recovering." So he actually came to me wanting to know if I could inject him with amniotic fluid. But after having had a little bit of exposure to amniotic fluid and seeing what it could do, that really kind of piqued my interest even more. And the same gentleman who provided me the amniotic fluid informed me of the availability of a newer and more potent and better substance that we're now using, which is the Regenerative Protein Array. Here in my practice, I have personally treated patients with different types of arthritis, autoimmune conditions like psoriasis and psoriatic arthritis, other autoimmune conditions like ulcerative colitis, rheumatoid arthritis, some neurodegenerative issues, Parkinson's disease, some MS patients, neurogenic claudication, so basically difficulty walking because they have pinched nerves in their spine, and instead of wanting to get epidural steroid injections, they would rather pursue other types of epidural injections, and Regenerative Protein Array really lends itself quite well to those types of applications and administrations. Virtually all of my patient experiences have been positive. I would say that everybody has experienced at least moderate improvement in pain and function. In addition to seeing some anticipated outcomes from RPAs such as improved range of motion and pain relief, we've seen some added benefits, so to speak. One of our early treatment patients is a patient who was treated for a rotator cuff injury, and so we treated him fairly aggressively for the rotator cuff injury, not realizing that the systemic portion of our treatment was also going to help with another condition from which he has suffered for many years, which is ulcerative colitis. Our RPA has affected my career and my career satisfaction on a number of planes. Having the ability to practice some unconventional or regenerative medicine has been a bit of a financial boost in that it has basically provided me another income stream, and it provides satisfaction on a multitude of levels. This really offers me an opportunity to provide some healing opportunities to the patients, and that provides satisfaction for me on a profound personal level, because one of my reasons for being a physician is to help people. And what many of my patients understand after interacting with me is that when they bring me a problem that I can deal with for them or help them deal with, they bring me a problem that I can solve or easily fix. Fixing that problem not only makes the patient feel better, but that makes me feel better.